Yeah, so at this year's genomic session, I think we hear a lot about the complexity of genomic changes in multiple myeloma and how these level of complexity is actually important prognostically with patients who have more mutations, a more complex genome having the worst prognosis, and also how these additional mutations can be acquired as the tumor evolved with progression, and also can be selected for by certain treatment. So I think this leaves us with a really very complex situation in myeloma where there are different levels of abnormalities at the DNA level, at the transcript level, at the epigenetic level, and the fact that these can continually evolve as patients go through treatment is particularly challenging. And in these sessions, we also hear about the fact that we need to target tumor early on where the genetic complexity is perhaps not as much. And also, we need to, as we move ahead, use this information in selecting treatment for patients. So moving away from how we treat patients today, where it's perhaps a one-size-fits-all with standard, say, induction regimen, is to perhaps in the future use more the genetic information to help us select treatment based on the type of mutations or genetic abnormalities that the patients may have. In the same session, we also hear a very interesting new piece of data from Professor Leif Bergsagel from the Mayo Clinic, which highlighted the fact that the microbiome of the individuals, in this case, in his case, the use of a mouse model, may actually drive disease progression by stimulating the immune system. And he also intriguingly mentioned that the similar kind of bad microbiome has been identified in lymphoma patients. So we don't yet have data from human myeloma samples, but I think this would be an important area that needs to be explored further as we go ahead, because we also know from other cancer that the microbiome may impact on the effectiveness of immunotherapy, and we hear a lot in this meeting about how important immunotherapy is going to be for myeloma. And so this connection between the understanding of the microbiome and understanding the response to immunotherapy would be an important area moving forward for us in terms of understanding myeloma. What we hear a lot outside of the genomic session, in a lot of the oral presentation in the myeloma genomics oral sessions today, is also that there's increasingly the use of single cell technology that allow us to further dissect the heterogeneity and understand tumor response to drugs as well as resistance. So I think this is another area that is very exciting, and a lot of work we can see is being done in this area. So in the next 1 or 2 years, we'll learn a lot more about how to use these technologies as we try to understand even the genomics of myeloma a bit more in the coming years.